Mastering Neurological Assessments. A quick guide. Hey, future nurses, Dr. Mike here, and today we're diving into the fascinating world of neurological assessments. Whether you're preparing for the NCLEX or just starting your nursing journey, understanding how to perform a thorough neurological assessment is absolutely crucial. Think about it. Our brains are the command center of our bodies, controlling everything from how we move to how we feel. So, when something goes wrong with the nervous system, the consequences can be serious. That's why we're breaking down this complex topic into easy-to-understand chunks. We'll cover everything from what a neurological assessment is to the red flags you absolutely need to watch out for. Let's get started. So what exactly are we talking about when we say neurological assessment? In simple terms, it's a head-to-toe checkup for your patient's nervous system. You're looking at their brain, spinal cord, and all the nerves that branch out from them. We use a systematic approach to evaluate the patient's central and peripheral nervous system function. This means checking things like their level of consciousness, how their pupils react, their muscle strength, their reflexes, and so much more. Why is this so important? Because neurological assessments are vital in a wide range of medical situations. Think about conditions like stroke, head injuries, meningitis, seizures, and even after someone has brain surgery. A neurological assessment helps us understand what's going on and guide treatment decisions. Now, I know what you're thinking. There's a lot to remember, and you're right, but don't worry, I've got you covered. We're going to make it easier with a mnemonic LOC MAP CRAN. Let's break it down. L is for level of consciousness. You're checking if they're alert, drowsy, or unresponsive. We use the Glasgow Coma Scale, GCS, to score this. O is for orientation. Can they tell you their name, where they are, and what day it is? C is for cranial nerves. Those are the 12 nerves that come directly from the brain, controlling things like smell, vision, and facial movements. M is for motor function. You'll assess their muscle strength and coordination. A is for appearance and behavior. Are they restless, agitated, or making strange movements? P is for pupil response. Those black dots in the center of the eyes can tell us a lot about brain function. Okay, let's talk about those cranial nerves for a second because they can seem intimidating. We've got 12, numbered 1 through 12, each with a specific job. Don't worry, you don't need to memorize them all right now, but understanding how to test them is key. Think about it like this. Each cranial nerve is like a wire carrying messages to and from the brain. To test them, we're basically checking if the messages are getting through. For example, to test the optic nerve, which is responsible for vision, you'd use a Snellen chart. For the facial nerve, you might ask the patient to smile, frown, or puff out their cheeks. And for the glossopharyngeal and vagus nerves, which control swallowing and the gag reflex, you'd use a tongue depressor. Now, while we're talking about neurological assessments, it's super important to know the red flags, the signs that something might be seriously wrong. If you see any of these, you need to act fast. First and foremost, any decrease in level of consciousness or sudden confusion is a big deal. This could be a sign of a stroke, a head injury, or another serious condition. You also want to pay close attention to the pupils. Unequal pupils, or pupils that don't react to light, can indicate increased pressure in the brain. Other red flags include slurred speech, facial drooping, weakness or numbness on one side of the body, seizures, and abnormal reflexes. If you encounter any of these, you need to call for help immediately. All right, future nurses, let's wrap things up with some high-yield tips, especially for those of you prepping for the NCLEX. Remember, when it comes to neurological assessments, always assess level of consciousness and pupils first. These are your most sensitive indicators of brain function. For patients with head trauma or stroke, use the Glasgow Coma Scale along with the NIH Stroke Scale for a comprehensive evaluation. And remember, any sudden change in neurological status requires immediate attention. Call the healthcare provider right away. In post-op neurosurgery patients, frequent neurological checks are crucial, hourly, or as per your hospital's policy. And here's a critical point. Pupil changes combined with a decreasing level of consciousness could signal increasing intracranial pressure, which is a life-threatening condition. And there you have it, a crash course on neurological assessments. Remember, mastering this skill takes time and practice, but with the right knowledge, and a keen eye for detail, you'll be well on your way to becoming a rock star nurse. If you found this video helpful, be sure to give it a big thumbs up and subscribe to my channel for more awesome nursing content. And don't forget to hit that notification bell so you don't miss any future videos. Now get out there, keep learning, and I'll see you in the next one.